Supporting kids with ADHD takes patience, understanding, and the right tools. That's where we come in. This is ADHD Connect with Dr. Tish Taylor, your go-to podcast for expert advice, real solutions, and encouragement every step of the way.
Hi, I'm Dr. Tish Taylor, and welcome to this episode of ADHD Connect, where we talk about all things ADHD regarding children and adolescents. Today's topic is about learning issues, learning disabilities, and ADHD. So the first thing that I want to mention is there are some challenges with learning when you have a child who is diagnosed with ADHD naturally, because, right, academics and school is having them perform and do things that tax their executive functions, and those things we call ADHD. So the first thing I might mention, actually, I'm going to back up a minute and talk about executive functions versus ADHD. What is the difference? So there's not a lot of difference between those terms, to be really honest. So we have defined ADHD because we have diagnostic criteria for that, right? If you look in the Diagnostic and Statistical Manual, we're at the 5th edition. If you look in there, there are specific behaviors listed where we define and identify what that is clinically. Now, when we talk about executive functions, you've probably heard about that term many times, and quite frankly, I use it a lot myself. There is not a specific definition. There is not an executive dysfunction disorder that's identified clinically that we diagnose. Not that people don't talk about executive dysfunction or executive functioning challenges, or that you can't find lists and definitions, anywhere and everywhere out there on the internet, because you can. But when it comes to a clinical diagnosis, we don't have that. But we still talk about executive functions, and they've been well researched. Nobody just has one particular definition for it. There's a lot of overlap and a lot of agreement about what executive functioning is. And a lot of what it is overlaps quite a bit with what we call ADHD. So you probably hear those terms used a lot together. In fact, I use them a lot together. Russell Barkley even talks about ADHD being an executive functioning issue or disorder in and of itself. So let me just clarify that. Now, forward again to the topic for today, which is learning disabilities and education, academics, and ADHD. So naturally, our executive functions and those features of ADHD are being taxed in school and with academic assignments. So very common things that you will see with most children with ADHD. Starting tasks, right? Starting an assignment, starting on assignment in a timely manner. This could also include homework, to where it drags out, right? Or sticking with the assignment or the task or the project or having difficulty finishing it. And so it drags out, especially if it's a longer term project or one that requires a lot of concentration and mental effort. We see this a lot with writing assignments, right? Because writing assignments or written expression in and of itself requires a lot of executive functioning. It requires us to organize our thoughts, organize what we're going to say. It requires us to translate it from our mind to the paper. It requires consideration of a lot of different pieces of knowledge, right? Like, what is my content about? How am I going to structure my sentences? How will I organize a paragraph? Am I going to remember how to spell all of the things? So there's a lot that goes into written expression, and there's a lot that we have to be recalling and thinking about while we're doing it. That in and of itself taxes a lot of our executive functions. So it is not uncommon to see students or children with ADHD struggle with written expression or writing assignments or essays. Now, there's a lot of technology nowadays, which certainly can help, like voice to text. That can certainly help, but getting things on paper, I have found over the years, is often a struggle. In addition to that, handwriting is a struggle for many kiddos with ADHD, hyperactive impulsive type and or combined type. Not every student or child with that diagnosis will have that, but many do. And it also seems to be some function of executive functions and at times there's a fine motor component to that as well. I just see that a lot. So concentration during lectures, or when teachers are providing a lot of information, or when you're having to read a longer passage about something that requires sustained concentration. So a lot of these examples I'm mentioning, you see, students struggle with when they have ADHD. Also, the emotional component can be, if you have combined type or hyperactive impulsive type, a lot of times those children have troubles with emotional regulation, get frustrated quickly, want to avoid things. Inattentive type can want to avoid tasks too that require a lot of mental effort. But so those emotional components can come up as well when you're trying to do tasks that are asking a lot of you, so to speak.
Looking for expert-led courses, trainings, and tools to support your child with ADHD? The ADHD Store has you covered. Explore practical, research-backed solutions designed to help families and educators navigate challenges and build success at home, in school, and beyond. From behavior strategies to executive function support, you'll find the resources you need all in one place. Visit tishtaylor.com and check out the ADHD Store today.
So, intervening, providing accommodations or strategies for all of those things, and it could be in different subject areas, is going to be important for ADHD. Now, if you have a child or student who's pretty bright or has certain strengths in certain areas, those ADHD pieces may not impact them quite as much. However, so let me kind of move into the second part of what I was going to talk about. If you have a student who there's a weakness in certain academic areas, or they have a potential learning disability co-occurring with ADHD, then there's even more struggle in certain areas, depending on what the area is or the identified learning disability is. I'm also going to talk as if you may suspect a learning disability, what you need to look for. So if there's a co-occurring learning disability, just know there are 3 areas we can diagnose: reading, math, written expression. So you've probably heard dyslexia, dyscalculia, dysgraphia. Dysgraphia has different components to it, but so dyslexia, what you will want to look for is beyond I'm having trouble concentrating on my reading. Am I having trouble, and have I been having trouble reading words correctly, mastering phonics or the phonology of reading and spelling? Do I make a lot of errors when I do text reading? So if you're seeing a lot of those basic reading kinds of struggles, and so if that's the case, the student is probably avoiding reading. They're probably avoiding reading. That's usually what I see. And it's a struggle. They don't like to read out loud, maybe. So it may be more than an attention issue. Now, sometimes you have students who have comprehension issues. They may be a pretty adept reader, but they may have struggles with comprehension. Now, that can come about with attention issues, but it can also be a comprehension issue. And when you see comprehension issues, you often see it with reading and listening comprehension, right? So if you tell me something one time, I may not get it, or I may have trouble comprehending what you say unless I hear it 2 or 3 times, or unless you break it down for me. Same with reading. So if you suspect there's a comprehension issue, that may be, well, that's not a particular learning disability. There might be a language piece associated with that, a language weakness or issue there. In math, so with ADHD, a lot of times you'll see students struggle with, longer math problems that require a lot of concentration, and there's many steps and procedures that can be a function of ADHD. However, if you have a child or student who continually struggles with getting procedures down, doesn't remember how to do procedures. They learned it, but then they don't remember and they don't retain it, or they have trouble with some math concepts. Again, they have trouble learning them in the first place, or they have trouble retaining them, or they seem to have a lot of holes in their math skills, which then usually makes them more frustrated and avoidant of math. And it can also result in lower self-confidence. Then you might suspect a learning issue in addition to ADHD. With the written expression piece, so I've already mentioned how there's a lot of overlap with executive functions and written expression. However, if you have a child or student who consistently lacks mastering writing mechanics, such as capitalization, punctuation, spelling, if they consistently show weaknesses and deficits in that area, you might consider, should this be looked at further? Or if they consistently write very little, like it's like they can express themselves in words, but not on paper. If they consistently show a lot of errors with sentence structure, grammar, semantics within their writing that really does not match what they're able to express orally, you might consider, taking a more specific look at those skills, and is there a co-occurring learning issue there? So hopefully I've outlined what, how to decipher some of those things, and, where you might want to look a little stronger if you think there might be something else besides the ADHD piece at play. So if so, certainly talk to the teacher or teachers, right? Have you seen this? Do you see this as well? And think about what past teachers have told you. You might look at, work products. You might try to put strategies in place, like, let's read together at home, if the child's young enough, let's read together at home and see how they're doing. Maybe you want to try tutoring, and maybe that makes sense. And let's work on those skills and see how your child is progressing. Or you may be to a place where you feel like, I need a more specific evaluation to really tease apart, do we have a co-occurring learning issue in addition to ADHD? So that's also an option. So yeah, so hopefully this clarifies a little bit more, gives you a little bit more input and insight into, is there a co-occurring learning disability, or are we seeing some of those typical ADHD executive functioning struggles within academics? So certainly email me with any questions you might have, drtish@tishtaylor.com, and I hope this was helpful.
That's a wrap on this episode of ADHD Connect. Want more strategies and support? Visit tishtaylor.com for expert resources. And don't forget to subscribe and share. Until next time.